These can run both in over 7.5 minutes.
Okay.
Sorry.
But-
The idea is if you have the 5 gram vial, you can't split that up. It's all gonna go into one thing, so it goes in over the 15 minutes.
Oh, and you rock it, you don't shake it.
You rock it, you don't shake it, you don't create air bubbles. Okay? Cool. Anything else we wanna do for this person?
I was thinking,
Transport. Hopefully before we do all this other stuff.
would you,
Not burn center, no. You're going to Riverbend. That's where you're going. Anything else?
I was thinking about the wheezing and fixing that, but I don't know if that's.
Fix that. You got that taken care of.
Okay.
Now, depending on whether or not as you bag, if you're still continuing to hear wheezing, you can throw the Hail Mary at it and try some neb treatments, bagging in some nebs, just knowing that it's probably not gonna help at all.
You Solumedrol?
Solumedrol, I probably wouldn't in this case, just because you're gonna be so busy with all the other treatment stuff, and that's a long-term kind of a treatment. You're not gonna see immediate reaction. When you guys give cyanide kits are pretty crazy. They are bright red, like as red as this cup. Like you can watch it flow into the vein. Like it flows in, and then like you can watch their arm and everything turn red, and everything just, their whole body starts to turn just bright red. Like it lights up all of the vessels, their face, everything is just beet red. People that are still kind of conscious, that see it, start to freak out. They start to freak out a little bit, right? So just know that is a normal occurrence as you get your cyanide kits. Okay? So, everybody went with ketamine, right? No, we had some etomidate? Yeah? So what'd you go with etomidate for? I'm not saying it's the wrong thing. Well, actually, I am saying it's the wrong thing. I'm just saying. What made you guys choose etomidate?
For me, I didn't necessarily think that this would qualify for respiratory disease, partly because.
It is not.
But I also forgot about the radial pulse, and that leads us to a blood pressure less than 80.
Exactly.
I understand that the heart rate of 30 that you got was from a radial pulse that you got from the parameters.
Okay, cool. So, good reasoning, so that would make sense. So I gave this scenario to 2 of my probationers the other night, sitting at the table. They really hate it when I start doing this. Because one of them is an old person. Yeah, right? And I told him, because like I had, Dylan Hookers was in last year's class. Well, his dad was sitting at the table with me last night. He finally, like 3/4 of the way through, he's like, hey, is this what you did to Dylan? I was like, oh, yeah, way worse, man. He's just like, oh, man, no wonder he was always so stressed, right? So like one of the guys was like, I was just like, I stopped him halfway through. I'm like, dude, are you having flashbacks of class? He's just like, yeah, absolutely I am right now. Because it was a guy I had like 4 years ago, right?
That's the guy from Bend, right?
Yeah. And so, but what did both of my probies do? They both went with etomidate. So what do I do as a person quizzing now?
You're wrong.
It opens the door, right? I went right after him. I'm like, you guys are practicing professional paramedics and you're making the wrong choice. I'm like, why? And so they went on and tried to explain all the reasoning. I'm like, okay, well, explain to me what the indications for ketamine are. And they went through and they ran through the indications. I'm like, okay. Does that change any of your thought process? And they're like, hypotension? Oh, yeah, we're gonna go with ketamine then. I'm like, okay, good. I'm glad I'm babysitting you on every one of your RSIs that you're gonna perform, right? And so that's why I showed up today, because these guys are practicing paramedics, right? Out there running calls on a normal everyday basis, and they don't have their stuff 100% dialed. Should they? They're on probation.
Yeah.
They are part of my crew. Should they be dialed 100%? Should you guys be dialed 100% when you hit the field? Absolutely. All right, 2 other quick little cases to talk about. You have don't look at the clock, Dustin. You want to talk weapons of mass destruction, or you want to talk about real life calls that we do?
I was just curious. I really
You need to take a break?
No, I appreciate your time. Thank you.
I mean,
Thank
take a
you,
break.
sir. No, it's
Take a
okay. Appreciate your time.
All right, so cardiac arrest in the snow. Person down, 10-minute downtime.
How
40
old are they?
Huh?
What's their temperature?
Dude, give me a second.
Run it through the thermometer. I got this one.
We writing this down to turn it? We're just talking this one through.
Like click, click,
Okay, so
click.
now Mons is in timeout. Mons does not get to participate in this scenario.
Damn it.
Trick your pog.
I'll
Shut
still
up.
put-
Okay, so it comes down to his initial fall injury, okay? So initially there's just one engine and medic going, right? 5 minutes into it, they said, hey, CPR's in progress. Boom, here comes the second rig. I was on the second rig that shows up. In the snow, down on snow day, right? 45-year-old females, down unconscious, unresponsive, pulseless, apneic in the snow. Downtime was less than 10 minutes. They said, hey, she walked out of the house 10 minutes ago, didn't come back in. She was just going out to the car. So we get there, second in rig, they're doing CPR. Okay, CPR is being done. They're like getting this person scooped out of the snow onto the gurney, onto the backboard, right? And there's this giant port hanging off of the chest. It's like,
Hanging off
oh.
the chest?
Huh?
Hanging
Yeah.
off the
So the port was here, and they had all like the IV tubing and everything for a dialysis type port, right? It's all still bandaged. It's a new thing. Recent diagnosis of renal failure. Cool.
Mm-hmm.
I'm like, for me, I'm just like, oh, ding, 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 ding. Red flags are going off, right? I'm like, hey, piece of cake. So we got a brand new, not my guy, thank goodness, because I really would have chewed him. But got a brand new paramedic, right? Been a paramedic for like a year and a half. He's running the show, and he's got his FTEP with him. And I'm just the truck captain that doesn't know anything about any EMS stuff, right? So we get in the back of the ambulance, and they're all like, I'm just like, hey, I'm sitting there and I'm watching, I'm waiting for them to do something. Like, finally I'm like, hey, does somebody want a bagger? And they're like, oh yeah, we'll do that. So they hadn't started bagging, they hadn't started doing anything like that. They were all trying to get everything hooked up. And I'm just like, so then I'm sitting there, I'm looking
Were they
around. I'm
doing
just like,
CPR?
they were doing compressions.
Okay.
So compressions were being done, and that was pretty much what was being done, right? And
You
so I'm
guys-
not the type of person that should be running this call, right? You guys, as the paramedics, are the ones who are supposed to be in charge of these things. And this is where it really irritated me, because this person was in my class at one point. And I'm just like, so finally I'm like, dude, I'm like, you gotta take control, man. You gotta take charge right now. You're in charge, make some calls, right? So there's like, okay, all right, so let's do this. And then, so then the engineer grabs a king tube, right? Well, I'm sitting in the airway seat, and I'm just like, well, look around, open up the intubation roll, grab my laryngoscope and ET tube, and I'm just like, hey, I bet you I can have this person tube before you have that king tube prepped, right? So I just went, took me like maybe 5 seconds. I mean, I haven't intubated in like probably 2 years. I was just like, oh, I was like, that was awesome, right? And so they're like, oh, why'd you intubate? I'm just like, well, because nobody else was doing anything, right? I was like, it's a secured airway, we're good, we're set, we're there. Coming up on, and we hadn't even made it to our first 2-minute rotation yet, right? Come up on 2 minutes, stop CPR, check, PEA, right? They give their epi, boom, we do another 2 minutes, getting everything secured, IOs, all that stuff. Coming up on the next 2 minutes, boom, still PEA. Okay? So we advance, right? This is where Kris gets a little irritating.
Did they switch fire?
So I'm sitting there and I'm like, all right. And they'd gotten the calcium ready, thinking that, okay, if we got a shockable rhythm, we're gonna get the calcium after we shock, right? So no shock advised PEA, right? They're like, okay, we're not giving calcium, we're gonna wait our next 2 minutes and we're gonna move, and we're gonna, and I'm like,
Why weren't they?
Why wouldn't they push the calcium?
just wait. So, maybe me, I took a quick second. I was like, okay, he's gonna catch it, because he's a good paramedic. Well, he should be a good paramedic. Took a deep breath and was like, so, why are you not giving it? They're like, oh, it's not a shockable rhythm. I'm like, okay, so what do we do for PEA, right? So now I go into this whole teaching mode with a paramedic that should know better, right? And it's like, they're like, oh, yeah, so we have to consider the causes. I'm like, oh, right.
Renal failure.
I'm like, I'm waiting. I'm just like, so do we want to consider the causes now? Yeah, let's consider the causes. And then, what does he do?
Push Narcan.
No, he's really, really close.
CBG.
He starts with these other things that we have a confirmed port on the
Know
chest.
exactly what the cause is.
Like, we have this, and I'm just like, finally, I'm just like, all right, dude, just stop. I'm like, and the guy that's holding the calcium, I'm like, hey, go ahead and give that calcium. I'm like, we're considering our causes, hyperkalemia, here we go, boom, give the calcium. Coming up on our next 2 minutes, like, I look down, and I can see this gal's heart through her chest go boom, 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 boom. And it's like, they check the pulse, and I'm like, oh, we got a pulse. I'm like, weird. We fix the causes, and the pulse comes back. Weird. I'm just like, so I'm gonna get out now. And I close the door. I'm like, hey, you guys have a fun trip to the hospital. And right as they're getting ready to leave, I'm like, hey, try not to screw this up anymore. Right? That's what I do, man.
Brutal.
That sounds,
No, I'm super brutal, especially for people that I know that they should know better, right? So it's like, so that's why I'm as hard on you guys here, because I don't want you guys to come out into the field, and I know, like, you should be better than how performance happens, right? And so I'm just like, okay, drive me crazy, I'm getting tired of babysitting, like, this is not what I do, you guys are paramedics, take your job serious, and know your protocols, all right? So that was number one, right? It was a rough day, right?
This is all on the same day?
This was all on the same day, dude. Like, this is what I said, this has been crazy, like, I was excited to come back and teach on whatever Thursday, because I had all kinds of cases lined up for you guys, okay? Next one. Similar thing, we were second in rig, but we all kind of showed up at the same time. 14-year-old is pulled out of a bathtub, unconscious, unresponsive, pulseless, and apnea.
Out of a bathtub, like suicidal bathtub, pills around?
Seizure,
Seizure?
history of seizures, pulseless, apneic, 14-year-old. Boom.
Go fit yourself and die.
What?
No, just-
No, what'd you say? Hold on.
Go
Say that again.
poop your pants and keep coming.
Okay, so why,
As a kiddo.
so that's a good question. So why go poop yourself?
Kid, he's 14.
Why?
Well, he shouldn't be
Why?
pulseless or apneic. And
Why do you need to go poop
I don't
yourself?
know. I don't know.
Does it make you uncomfortable? But you realize that people call 911 because we're the
it's
ones that
not-
are supposed to show up
Absolutely.
and be totally cool, calm, and collected, right?
Absolutely. Yep.
Do you think everybody's cool, calm, and collective on that?
Nope.
Oh, no.
Absolutely not. There's freaking chickens with their heads cut off running around the scene, right? Once again, the other paramedic, not taking charge, not because they got ramped up on that exact thing, right? There's like 6 cops that showed up too. And they're just like, hey, we can do CPR, blah, blah, blah. It's like, no, dude, I just need you guys to just stay over there. Just stay over there. Just, if we call you and ask you for stuff, then just, hey, hand us that colored box, right? It's like I pointed out all the epi to them and like, hey, if we call for epi, hand us one of these boxes, right? And gave them something to do,
Yeah.
right?
Go boil water.
Obvious
Boil
airway
water.
issues. So brand new paramedic puts a king tube in, right? What do you think comes out of the king tube?
blood,
Water.
water.
Blood, water, sputum, constant, right? 2 full canisters of fluid and liquid, right? Just constant suction. And initially it was water, it turns into blood, just constant, right? So mostly
Where's the
asystole,
blood coming from?
just a constant, there was questions in regards to that. And so,
Well, I have that question.
we'll get there in a second, okay?
I have that question.
A second, okay? So this person has a long history of seizures, and constantly has grand mal seizures. Why this person was unattended in the bathtub, unknown, right? So PEA/asystole the entire time, right?
PE and
Yeah,
assistole
it's
or
going back and
going
forth
back
in
and forth.
between 2 minutes, like you get a little bit of something. And when I say PEA, it was like maybe a hint of a complex, virtually nothing, right? Bad deal. So what do we do with PEA and asystole?
You don't shock.
You
At
push
the end,
epi
reversible causes.
and figure
We fix
out
our
your versus-
causes, right? So like 6-8 minutes in, I'm just like, hey, so have we fixed all of our causes? And there's this long pause, and finally I looked at the tech. I'm like, dude, like we can't stop, we can't do anything until we fix all our problems, right? Blood sugar was 20. That was the first blood sugar.
That's like the one I.
Second blood sugar said low. That was after AMPA D50. Oh, weird. So what do we do?
Circulate.
So we gave another AMPA D50.
Still low.
Now what?
What's his town?
Now we're at 20 again. temp is totally fine, because we did check that.
Okay.
Because I did, because she came out of the bathtub, I don't know, they say it was 10 minutes, but I didn't, so yes, we did get a temp. I would say it was 96.8, 96.8, something like that.
Well, nutrition.
It was.
Were pupils pearl or sluggish? Not
They're dilated,
dilated.
fixed. So we called the doctor, right? Because like the crew was just like, dude, like we're out of things. We've been in, like we worked it for like 40-something minutes,
Could
right?
they overdose on
So no
insulin?
overdose, no nothing like that. No.
overdose on insulin? Was it
No.
diabetic?
No history, no medication, nothing.
Just seizure medications?
So it does take the seizure meds, but
Okay.
no diabetic meds, right? So what happens when your body seizes for a long time?
You
What
use-
You get
Yeah,
All right, so more than likely that's what we figured probably happened, because they described when this person does have seizures, they're close to 10-minute long seizures, right? So it's like, okay, well, the person was in there for 10 minutes, it's like you would think you would have heard something in there while it was happening, right? Who knows? Long story short, this person got 3 amps of D50. You think we just gave all the amps of D50 just for, like, or, like, at what point do we have to, like, call and be like, hey, we're moving outside our scope of practice here a little bit, like. So after our second one, we're like, hey, just double checking, we're like, we need to give more. And they're like, because this person was maybe 60, 70 pounds, right? So that should have skyrocketed,
Yeah.
right? So then the doctor had the gumph to ask if we were doing adequate CPR to be able to circulate this stuff, right? We're like, have you seen us do CPR? Like, that's the one thing that we do good at. Do
do good.
You do good?
Right?
You do good.
Uh,
I had a doctor on the phone with medics, hung up the phone, and they were like, well, I don't know, are they competent EMTs? It wasn't to me, it was to the charge nurse that it was a side conversation.
Okay, so we fixed that issue. We gave Bicarb, we gave Narcan, the doc actually gave us an order for calcium just for the heck of it, as a last ditch kind of Hail Mary kind of thing. But at that point, it was a constant frothy blood fluid that was just, basically it was just flowing out of the,
And you just had a king in?
yes.
Were you able to get a tube in?
So would you wanted to do a tube in this situation?
Yes.
Yeah.
Right.
Yeah.
Well,
So
duh.
a good competent paramedic would have been like, ooh, this king probably isn't getting it done because you probably filled the gastric contents up with fluid, right? So what does a non-competent paramedic do?
Just leaves the
Put a
king
king.
in
Leaves the
suctions.
king tube in place, right?
Were you on this call?
Yes, that's why I
Did
want you
you-
guys to be better than,
Did you guys ever
Did you-
switch?
Did you make them intubate?
so by the time we ended up making that transition where we're like, hey, why don't we pull that, do that, they made the determination after 40 minutes of stuff, that it was just, they were just gonna call it, so.
And title never came up?
And title never, so we had a initial reading of 12 on the initial, and then we had a bump up to 17 after we finally got the sugar up, and then it went right back to 12, down to 8 to 7.
What were lung sounds?
So we had a constant suction going the entire time.
But your suction was through gastric suction.
Right. Yeah.
You never got.
How effective was
Never
it?
got good airway. See?
Right.
So see, and so that's where having new paramedics, like you're constantly having to fix and correct some of their treatment stuff. So the nice thing is we have some of our, some of the newer paramedics that we're kind of transitioning, like you guys, to, hey, listen, it's okay to use the ET tube to drop tubes. It's like, don't, just because we say king tubes, doesn't mean that's the one and only.
I don't understand why, if the king was dropped initially, okay, fine, the king was dropped, but if you suspect a drowning and you're having this amount of stuff that you have to suction out, but you're not suctioning anything out of the lungs, at 20 minutes,
No positive
at
changes?
10 minutes, doesn't really matter how, at 30 minutes for that matter, why would you not say, fix your problem, and that's the problem?
So that's exactly part of the issue is paramedics are not conceptually understanding what they're doing, right? So that's why we're trying to get you guys to be able to understand. It's like the exact question that just popped up here of, well, it's like, well, what are we doing? Like, what are we suctioning? What are we truly suctioning? Right? And so, once we did a little examining, so a lot of the blood was, part of the tongue
Right.
was
That's
actually
what I was
just,
wondering, the blood, if she had a seizure, then I would suspect she bit her tongue.
yeah, so that's where the
And
blood
that's-
actually was coming from. So there was fluid plus the blood. So,
And
Wait, Chris, why did you not on scene have them pull it earlier than that then?
so as one person, like I was task oriented early on with other stuff, and so very late into it, I finally transitioned up to that airway position area, and I was just like, hey, and they were on the phone then, making the call to pronounce. So I was down on the IO at the other end, and probably 90% of the 90% of the call, pushing the meds and doing that kind of stuff. And so I actually didn't even realize what all was taking place up there until very late into the scenario. So then we had a discussion afterwards about, hey, you know, conceptually, you gotta understand what you're doing, what's happening here, so.
just the structure of a king
Yes,
versus a
exactly.
T.
That's why I'm excited for them to switch out of that scene.
That's why I despise kings, by the
Yeah.
way. Yes, Melanie.
My question isn't helpful.
It what?
It's not helpful.
Okay. Okay, cool. So you guys are gonna be better than that, right?
Yeah.
Yep.
Take a quick break, then we'll get going.
About time. Just kidding.
Oh,